Development Board.
Elena.
Morning, everyone. Elena Truworthy, Office of Early Childhood Deputy Commissioner.
Trisha.
Good morning, everyone. I'm Trisha Morelli, and I'm from the Department of Social Services. I oversee the cash programs.
Tasha.
Hi, good morning. My name is Tasha Harris. I am the Chief Executive Officer at Collective Collaboration Consulting, which is an organization that assists small businesses and nonprofits in program design, grant management, and anything else that they need.
Melvette.
Hi, good morning, everyone. I'm Melvette Hill from the Commission on Women, Children, Seniors, Equity, and Opportunity. So glad to be here with all of you today. And
I'm doing the toss and
Oh, you
Melvette.
are.
Don't
Okay.
have to worry. Yeah, Joy.
Good morning, everyone. My name is Joy Zavarella. I work for the Department of Correction. I'm one of the supervisors in the Reentry Services Unit.
Great. Jim.
Good morning, everyone. Sorry, Jim Boucher from Capital Workforce Partners.
Great. And Stefan.
Stefan Palmer, two-gen parent leader for the state of Connecticut.
Great. And Kelly, I think I missed you.
Yeah. Good morning, everybody. Kelly Fitzgerald. Apologies. United Way of Greater New Haven. I oversee our economic mobility work.
Great. Welcome. And David, you just joined. We're just saying name and organization or affiliation. He may not be quite on yet. So I will turn it back to the team.
All right, so this is our agenda for today. We did work group introductions. I don't know if I saw any new faces to this group, or maybe I just have seen them in other meetings and they might not be new to me. So welcome if this is your first time joining us. Today's agenda, we will briefly talk about our transportation feasibility study, really high level where we are at currently in that study. And then we'll bounce it over to benefit cliffs. And in that benefit cliffs, we'll just give a quick highlight because in our last meeting back on December 4th, we did a very thorough presentation around the benefit cliffs. And so we just want to give some updates on some things that have been happening in the field and how we just want to clarify some information in case there's confusion so that all of us know how to speak to that benefit cliffs analysis report, and we will also share that report with you. And then we'll pop over to some legislative updates. There's about 3 or 4 that we wanted to share with all of you. And then Sarah will guide us through the landscape presentation, the impact of cuts on families that are currently happening with the federal government. We'll do a maybe 10 to 15 minute breakout session since we're pretty small today, and then come back as a whole group, report out, and close us out. So I'm going to go ahead and toss it over to Shanae. She will take us through the transportation feasibility study and where we are currently.
Thank you so much. I was revising my notes. Okay, so back in December, the OWS along with DOT, we have a pilot project that we've been working on trying to streamline ways to improve economic mobility for low-income individuals and families. We did conduct a survey, which was circulated across the state and to some of our two-gen parent leaders, looking for ways to randomize feedback on ways to make improvements in this area. And so we asked a lot of demographic questions. So questions came up if we should keep it in more metropolitan areas such as Hartford, if we should expand to more rural areas as well. And we received about 78 responses from that. We had an expectation of about 70 of them, but we did get an expansive amount of feedback on that. We're also, this year, we've been working on strategies for vehicle purchases, rideshare subsidies, mobility wallets, and transit passes. Right now, we're just looking at a deeper analysis on the mobility wallet because that is, pretty expansive, as well as we are let's see, we have rideshare subsidies with Uber and Lyft access and vehicle purchases focusing on helping people with purchasing and car maintenance. And right now we're going to be looking to have an in-person meetup with this. Sorry, my son's school is calling me. We're also looking to have a in-person meetup. I think we mentioned June, but we're just trying to see where we're going with that. But right now we're just in the process of still reviewing some of our options with the mobility wallet. If there's anything that I have left out.
And I think, Shanae, we're also looking at the car option. Those are the two
car options,
they're
yes.
costing out what a pilot would cost, so that we can try and understand how to support families.
I see a question, Maggie.
Yeah, I haven't been in this group too often lately. Can you just describe the mobility wallet?
Shanae, do you want to describe mobility wallet, or do you want me to?
I'm sorry, I didn't use it. She said, ask, what was the mobility wallet?
What is a mobility wallet? Yeah.
Oh, if you can, I have
To the best of my knowledge, and OWS team and Christina weigh in, a mobility wallet means it's basically an amount of cash that you're given, and you can use it for an Uber, you can use it for a bus, you can use it for.
That's simple. Okay.
Yeah.
Great.
So,
and isn't it something that would go on like a debit card, I believe?
Yeah.
so.
Yeah.
Yeah. So they're looking at like administration costs. They're looking at like, they're trying to understand kind of what it would cost for us to do this and where and how it might be scalable, knowing that transportation is a major issue for families, both for economic mobility and just for kind of living. So trying to figure out how to support families in that.
But knowing that the mobility wallet is a little bit more complicated, correct? Yeah.
And just
and more expensive.
Yeah.
But that's why they're doing the study, so that they can put all this together. And then at the end of that study, we'll be able to determine, what is the best option. And hopefully we can support the study in a pilot form. And I wanted to also, because this isn't, we are in partnership with the Office of Workforce Strategies. I don't know if Anthony, Grace, or if you want to just jump on and say a few words. If not, we also did have a very thorough presentation last time we met. And I can also share out that presentation again, so that everyone has that and can take a look at that. And if there's questions, you can feel free to reach out to me, and I'd be happy to have more conversation.
And also, Mike, if you want to add anything, because you've been jumping in on the table too.
See, Anthony,
the only thing I would add is just that the mobility wallet is typically done through like smartphone apps because it helps streamline the process. So that way, if you had to pay for parking, rideshare, some of these bikes, any form of transportation, it just helps to streamline the process. And I think for some people that is easier versus having multiple payment systems. Plus, it's actually in one system that you can actually use multiple modes to cover. So there are some good points to having it, but the main thing is usually on an app. And it's in one single place, but and it does cover if it's traditional buses, if it's parking, anything, you can actually pay for it directly through that mobility wallet. So, but we have to go through the process of doing a study. But in most cases, if you do have a smartphone, that could be a barrier too, if you don't have a phone or you don't have the ability. But in most cases, if people usually operate through their smartphones or their as a way of communicating. So I think for that process, I think it is a really good value add to be able to have that mobility wallet, but it is more expensive, if I remember correctly.
Anthony, can you just confirm? I believe we had a few other areas across, not our state, but across the US that were using the mobility wallet, and it's been
I feel like if I recall, I might be wrong, but I feel like it was California where they tested a lot of it.
Yes, I believe.
And Oregon, I think.
Yes.
And I think the one other thing to say, kind of building on a little what you were saying, Anthony, but a little different is, right, mobility wallets probably respond to a more entry-level job kind of situation. In order to support a car, and Mike, you've been eloquent on this, to support a car, there's a certain income threshold that you have to get to. So one of the things we have to kind of sort out is who and how we're going to target. Because it's also true that our hope is that it will connect to all of the kind of training that OWS does, right, and sponsors, so that somebody who gets a job might have temporary support from OWS or from a WIOA board, right, from a WIB board, to be able to manage transportation. But at some point, they won't have it. So the question is, have they gotten enough of a wage that they can then afford a repayment? So we're working through the income parameters. So just wanted to kind of note, that's one of the things we have to sort. There's a lot of things to balance here, because transportation is so difficult. And so trying to kind of figure it out. And I would just note from my perch, there are not a lot of states trying to tackle this. So, kudos to us for trying to figure out what is a fairly difficult issue, but one that stops mobility over and over again for families.
Mike, thank you, Anthony and Sarah. Mike, did you want to add anything? I just wanted to make sure.
No, I think everything that Sarah said was spot on. I mean, I think with the two options we're considering right now, the mobility wallet versus the car ownership repair program. I mean, there's sort of pros and cons to both of them. As you guys have pointed out, the mobility wallet is sort of expensive and feels like a more temporary solution to me versus the car ownership. But as Sarah just pointed out, the car ownership piece can be very expensive, and there are a whole lot of issues that come along with that, but it also provides a longer term solution for the client, both not just for work, but for their life in general. So there's pluses and minuses to both. So that's, I think I'm eager to see the results of the study and kind of where we land and the cost of each of those options.
Agreed. Elena, I see you unmuted.
Did, and I, for some reason, have had my coffee and can't figure out how to raise my hand at the moment. But thank you for noticing, saving me. I just wanted to say, from the OEC's perspective, we're so grateful and happy and enthused that this is being worked on and trying to be tackled. When we went through a lot of the Blue Ribbon planning process, and even still today, we are hearing so much around the challenges with transportation and families being able to get to identify childcare opportunities for their young children so that they can then get to work or higher ed or some training program. And so that continues to be a significant barrier. And so just wanted to raise that up. And as we think about pilots moving forward, that opportunities for early childhood, supports to be in that equation would be great.
And it is Elena. Oh, go ahead.
Yeah, I was going to say it is, because we're now looking at wraparound services for all of that. So it's regarding employment opportunities and access to childcare as well. Those are factors.
Yeah. And we've when we did the focus groups with the parents, they lifted up a lot of those things, a lot of those concerns, especially like in our desert areas across the state. Like, how are we getting families from the what is it, the Northwest back into where they need to be. And then we also communicated about like where I think OEC was doing some of the childcare desert research and trying to identify that. And so I tried to connect the contractors with our internal data specialist person. So hopefully they were able to connect and speak to that. So yeah, we definitely have been putting childcare in the forefront. We know how important that is across our state and for families to, be economically mobile. So yes, sir.
We should keep moving. I'm watching time.
Yeah, me too. Okay. All right. And so I'm gonna toss it over if there's no other questions about transportation. I know this work is super exciting, and OWS, our partners, will definitely have something in the near future. And so we're excited about that. All right. And so here we have next on the agenda, I just merged item and agenda. There you go, y'all. Benefit cliffs. And so I'm going to toss it over to Amy to talk a little bit about that.
I love that, Christina. I am going to use that agitum. Let's skip the agenda right into the item on it.
Yes.
I'm so happy to see all of you. It's been a while, and I've transitioned some, and so I'm glad to see so many familiar faces here doing this work. So as you all know, we have been talking about this
Dude,
benefit
what,
cliff
what,
pilot
what is happening here?
for a
Because this
while.
guy, what is he doing?
Hold on, I'm gonna mute
Janine, you need,
Oh, I'm
Miss
so sorry.
Janine.
So sorry.
um, so we've been talking about this for a while. Social Finance did a report that was really around conducting a cost analysis of what the pilot might cost, looking at several different bundles and scenarios using benefits. And we think we have a best shot at what the standardized benefit package would look like and cost. And the exciting thing is that there's movement into not only the pilot moving forward, but it being it's been proposed in a bill, so it might go into statute, and that is House Bill 7104. I know some of you may be interested in following it, but sort of big picture, it's proposed looking at 200 families over a period of 3 years, and the kind of framework around it is that the DSS commissioner, when evaluating determining TANF eligibility, could disregard the income of folks participating in this program. One, this would be the pilot study. One, they would have to participate in a job training program, ideally with kind of two steps. One, a transitional step of that's maybe training or education, and then into a more ideally stable employment situation where their income would be at or above the benefit cliff threshold. And that is when that's when the income would be disregarded. And during the meantime, and this is the proposed bill language, they might have the benefit of a direct cash transfer. And so at this point, the bill has been passed out of the Human Services Committee, which is really exciting. It still needs to go up for a vote. And no guarantees there, but there has also been a fiscal note that's been put in place. You can check that out on the CJA website. But I think from our perspective, it's the cost analysis is a little high, and that I'm going to kick it over to Sarah to kind of explain the details of that a little bit more.
Yeah, and the bill and the pilot study kind of didn't exactly sync up. I guess we should say that. But so the fiscal note they've put on the pilot study, I think, is represents two different kinds of costs. The vast majority of the cost of a pilot will be in the benefits that people continue to get. So it is not a net new cost to the state because you're already receiving SNAP or TANF or whatever benefits you are receiving. So that is included in the fiscal note. Social Finance did not feel comfortable, parsing out kind of which was which too much. They did some. So the majority of the cost is really in staffing and evaluation. So we think that the cost is more like 700,000 a year rather than 1.4 million a year. So it might be 800,000 if there's some slippage around the benefit work. And we expect that philanthropy is going to kick in for some of that. So the fiscal note is the fiscal note. We just want folks to know because people are going, oh, this is a really expensive pilot. And what we want folks to know is that the costs are mostly in the realm of benefits already in receipt. So it is no new net cost to the state. And I think that bears, we're going to put a cover sheet on the benefit cliff pilot study to kind of clarify that. Back to you, Amy, unless folks have questions on that.
Thanks. And I'll be quick here just on a couple other legislative updates. One that I am so excited about because if you have listened to me in the last probably like 4 years, we have been talking about an income disregard for young people who are on a housing voucher, a RAP in particular, which is Connecticut's version of a housing voucher. So there have been two bills proposed. They're pretty much the same. Sometimes this happens when our lovely legislators are not talking to one another, but House Bill 6941 has passed out of the Housing Committee, and that is an act that would exempt the earned income of individuals age 18 to 24 in a RAP household. So it is passed out of the Housing Committee. RAP, if some of you are unfamiliar with it, typically households pay 40% of the rent, and the subsidy covers the rest unless you're elderly or disabled, and then it's a 30%. But I will say some of the bill language is a little wonky because they exempted income up to $100,000, which seems a little high and might turn some legislators off. So I think that has turned some legislators off to supporting it when, you know, the research we've done really shows that the average income of folks in that age range on a voucher is more like $9,500 a year. So we're still hoping it's going to move. It should. We're excited. If you want to do any advocacy around that, let me know and we can get you set up for that. I think I'm going to end it there because we've got to keep moving.
Just one thing, Amy, did you mention
Sure.
that the benefits cliff bill 7104, that's been referred to approps, and it's on the approps committee agenda for Monday, along with a whole slew of other bills. So you'll know whether they voted out of approps or not. And if it doesn't, it's dead. But so you'll know more on after Monday.
Awesome. Thank you, Maggie.
Yeah, thank you, Maggie. Okay, we're gonna go ahead and if there are no other questions, and I don't want to feel like we don't want you to ask questions. So if you have them, please just shoot them out. We can adjust accordingly. If there's no questions, I'm gonna go ahead and toss it over to Sarah. We're gonna go ahead and do the landscape presentation, the impact on cuts to families in our state and what that looks like. So just bear with me 1 second while I share my screen. My screen. What is happening with me?
Queen. So while she shares her screen, just a note for folks, if you have other bills that we should all be aware of that affect families, put them in the chat so that we can make sure we're all paying attention to things that are going to be affecting families.
So many of them.
I know, Maggie, you can just spend the rest of the meeting like, you know, rolling it through, right? But if there are other key ones, go ahead, Christina. Okay, so what we wanted to do today was we don't know yet all of the cuts that are coming. We have seen some proposals around, this is from the federal government. So we've seen some proposals, and what we really want to talk about today, just kind of go through who's on which programs, kind of what are the potential impacts for families. And one of the reasons we decided to do this was because we've all had conversations with families and kind of the stuff hits and they don't know it's coming, right? And so I think one of the things we're hoping to talk about today is how are we helping families to know that this may be happening? And so what are kind of our communication strategies? And as people who care about families, are there ways that we are coming together to try and get ready for what might happen? So again, none of this has actually happened. Some of it is in play, but some of this has not happened yet. But the House budget resolution, which is requiring $880 billion to be cut from Medicaid, and so may not be all $880 billion, but it's at least $500 billion if they maintain their focus on the level of cuts. So the Commonwealth Fund has estimated that we would receive, you can see it here, $775 million less annually in federal funding, and that will result in a whole bunch less economic activity and the loss of thousands of jobs. Head Start has been proposed to be, let me back up. There's a 64-page document that got leaked last week or the week before that is the proposed HHS Health and Human Services budget. If people would like to see it, we can send it out. It's a public document. It was leaked to, I can't remember who, the Washington Post or somebody. And so some of this is kind of looking at that. So Head Start is proposed to be cut under that. And again, I want to say it's not out there yet, but it will be very shortly. I had thought it was happening this week. It may be next week that they put out their version of the budget. SNAP, which we may not hear about immediately. It'll probably happen inside the Farm Bill, which has to happen by the summer. 1 in 10 of our residents are using SNAP benefits, and they are $72 million a month. And so you can see the impact this would have on families and on actually the economy. I'm not sure grocery stores are so happy about this. Next. TANF, TFA. In 2022, we spent about $552 million in funds under TANF. We only spend 4% of those funds on basic assistance. We're kind of one of the lowest folks on cash assistance. So just want everybody to know that, so you can kind of see where the money is spent. And again, this one we've not heard a proposal on yet. We do know that work requirements are most likely coming for both Medicaid and TFA. And so there's going to be, and SNAP as well. And so there's going to be a large adjustment in operations. And I can't remember who I was talking to, somebody in one of the New England states saying, in order to manage these work requirements, it's going to require an incredible investment by the state to be able to make them even happen. And so instead of supporting families directly, we're going to be kind of managing the make work moment. So that's kind of what may happen. Next slide. Housing, this comes from the Center on Budget and Policy Priorities. Right now, we have 161,000 households, people, and 84,000 households that use federal rental assistance. There is rumor that there may be significant cuts to rental assistance, either freezing them, reducing the benefit. There's a bunch of different ways that it may happen. There's already been cuts to some of the housing development work that would be bringing more affordable housing online. So that's been already happening. I do work with the Local Initiative Support Corporation nationally, and they've experienced a pretty significant cut in the work that they do to try and build healthy communities with affordable housing. Next slide. So LIHEAP is proposed at this moment, if that 64-page document holds true, to be eliminated. They already fired all the staff of LIHEAP, both at the federal level and at the regional level. And so in Connecticut, we have 100,000 households being served. I'm glad to hear that, Amy. The total funding is $122 million, and much of it is for heating, some of it is for crisis in winter, and a small amount is for weatherization. Elderly folks, families rely on this to be able to stay warm during the winter. Next. And school meals. So there's a proposal, again, still just a proposal to eliminate the community eligibility provision, and it allows for universal free lunch and breakfast. And right now we have 262 schools in Connecticut that wouldn't be able to provide free meals, 43 school districts, and 128,000 children who attend schools that won't be able to use the CEP provision, which has really helped with reducing childhood hunger. So, none of it has happened quite yet. We know some of it will happen. Maybe not all, but some will happen. And so I think what we wanted to do was, oh, Kelly, you have a question. Let's start there. People have questions, and then we can kind of move into small group.
It wasn't necessarily a question. I just wanted to add on the housing front. The other thing that we're seeing to start already has been a deeper dive into documentation status of everybody who is receiving any type of federal resource. And it's not to say that that hasn't always been a rule with that funding, but many of the programs historically didn't require all vital docs and right. So people who were experiencing homelessness didn't have access to all their documents. We were able to put them in programs, and now there's just a big kind of deep dive look to ultimately push people out. And so yes, it's going to affect those who are undocumented, but it is also going to affect those who just don't have all their information. So it's something that I think is going to be a big concern for Connecticut families, particularly being a sanctuary state and a New Haven city. So I just wanted to flag that on the housing front because that's happening now.
That's super helpful. And Kelly, just a quick question. Have you been using self-attestation, which is what, like, I know sometimes in various programs, that's how you manage around some of the challenge of you're experiencing homelessness and you don't have documentation. Have you been using that and now you can no longer use that?
So we've never been, I mean, at least on the housing front, we've never been able to use self-attestation for if you're illegal for your citizenship status.
Well, I wasn't
some
thinking for
programs didn't
citizenship.
require us to document it.
Yeah, no, sometimes it's for income. You can do self-attestation. So, okay.
Yeah, no, that hasn't changed. We haven't seen a change in that.
Other comments or questions before we break into small groups for just a few minutes?
Do you know if that last slide that was about food, does that include CACFP, the Child and Adult Food Program from USDA, or was that a different funding source?
I don't know. We can check though.
Thank you.
Also, another question. Do you know, I've heard that the food share program has had significant cuts, but I'm not sure. And it's specifically to the farmers, the local farmers program.
Yeah.
Do you know anything about that?
So they've done a couple of things. There was a whole farmers program to source local food to schools, and that is gone. So that's Caroline, part of it. And I can't remember the source of this, but there's something was cut that was aid to food pantries, and to meal programs, that is causing significant hardship on the nonprofits who are trying to feed folks.
Right.
And I'm spacing out what the name of it is, but there was that too. Maggie.
Can you share the PowerPoint with us? Send it over to us. This was really good. I'd love to take a further look. It was great.
Yeah, all the materials will be sent after this meeting. So I plan to send the 66-page document link, the Benefit Cliffs pilot study, the cover sheet that accompanies that study, the Zoom link so that this is recorded and if you need to reference it back, some of the bills that were referenced, and then the PowerPoint as well. And I see Mike, your hand.
Thank you.
Yeah, thanks, Christina. I just had a question for Sarah. I know you mentioned, Sarah, about the possibility of some dramatic changes in the TANF work requirements and the fact that it would require an enormous investment on the part of the state. And I was just wondering, do you have any more detail than that to share?
I don't.
Okay, no problem.
Yeah, no, I don't.
Okay, that's all right.
So yeah, what I'm understanding is that both for work requirements in Medicaid, right, and in TANF, like all of them, trying to figure out who's eligible, who is not, doesn't need to, like all of that is going to require significant investment. So.
Gotcha. Okay, thank you.
Well, and also in North Carolina, where they did the work requirements for the Medicaid recipients, they didn't have the staff to do what we do in terms of the verification, the recertification, and so the burden on the system was so much. They're like, we can't do this, So I don't, DSS would have to literally ramp up between the food stamps and the Medicaid. I mean, we do it in TANF now anyway, right? So we have work requirements in TANF, but it would be Medicaid and food stamps, and that administration would be the killer.
In New Hampshire, the last time they did it, they had to go door to door to figure out eligibility work. It was pretty incredible for the Medicaid work. Amy.
Real quickly, I'll just say there's also talk of work requirements for housing subsidies as well, and that came directly from a federal staffer that I was in DC in March doing some lobbying, and that was from like a federal staffer working on the transportation, housing, and urban development budget. And so I don't know what that means other than he said to keep an eye out for it.
Yeah. Any any other? I'm wondering. I think we may want to. Yes, Christine. I think we may want to stay here. So we don't know what's coming, right? Let's be clear. We know something's coming. I think as to Jen, we think maybe we need to figure out how we're letting families know that this may be coming. Yeah, I think that's right, Kelly. Any benefits are going to have work requirements. And so, you know, it's very unclear how everything's going to play out. Again, I think we would like to think about, are we letting families know that there are changes that are likely to come? How are we doing that? You know, are we helping families to know that they should be speaking up about what they need to be able to live and survive and thrive? And so kind of are folks thinking about that? And given kind of the breadth and depth of potential changes, that's the first question. The second question is, are we getting organized in any way, shape, or form to be ready when this happens? Because when these federal cuts come, there are going to be some hard decisions at the state level about what to do. And so, I was listening to somebody, I can't remember, some podcast or something saying, they're saying, well, there won't be cuts to Medicaid, right? And yet what they're doing, one of the proposals is to block grant it to Connecticut, and then Connecticut ends up with the hard choices, right? And so then what do you do? So first question is, are folks talking to your participants? Are you talking to families? Should we be talking to families? Should we be communicating out that this is happening? Let's start there and spend 5 minutes on that, and then spend 5 minutes on kind of, is there any way we're getting organized?
Before we answer that, I'm just wondering if my friends from the Department of Corrections are still here. I know David was having trouble with technical issues, so he hopped off. But I can't remember. I know we had one other person.
I
I'm not
see
sure.
Joy.
I'm here.
Yeah.
Okay, awesome. And I know that you all in corrections are doing some work, trying to um support males coming out of prison into the workforce, and what that looks like for them in terms of benefits. And so would love to hear from you all on what that transition looks like. I met some really amazing people from the Department of Corrections at the Workforce Summit that OWS put on, I think it was last week. And they talked about the really great programs that you guys were implementing. And so I don't know if you can speak to that, Joy, but I don't want our friends in corrections thinking that this space isn't for you all as well. And we know that you serve a really great population transitioning. And so we want to be able to support that through this effort.
So I could speak to what the reentry services unit does. I know that, unfortunately, I'm sure other agencies are this way, but DOC kind of works in silos. So, the education department, the substance abuse, mental health, everything is kind of separate. We're trying to work together the best that we can, but it doesn't always happen. So I'll start by saying that we have a reentry counselor at every facility, and we work to ensure that every individual who is releasing into the community is offered at least a birth certificate, social security card, and DMV ID, because we all know that is needed for employment. It is not mandatory, so they are able to waive requesting those. And there are also other things that happen. For instance, if they're born in Puerto Rico and they do not have a valid DMV ID, they aren't able to request a birth certificate. So there's a lot of barriers. If they're born out of the country, we can't help with a birth certificate. We make sure that medical insurance is activated for the lower level medical and mental health individuals. And then we have medical discharge planners who work with the higher needs population. And then we make referrals to the various welcome centers throughout the state, and they are one of our biggest supporters and resources in the community. So there's Hartford, New Britain, New Haven, Bridgeport, and Waterbury, and we're actually working on an agreement with New London OIC to get a referral process in place with them. And so we actually will send a referral, and then the Welcome Center staff will then reach out to do an in-reach phone call to connect with the individual prior to them being transported directly to the program, which we found has been really helpful in them actually agreeing to go on the day that they're scheduled to release. In addition to that, I actually supervise the employment piece. So I have two counselors who are running an employment program. And this takes place at Robinson, York, and at McDougall Walker. It started out as a grant that we had. The grant is now up and we're just continuing on, but they work on things like resume building, interview skills, job search, soft skills, that sort of thing. And then they do job search and give them resources for when they're going to get out, like going to the Department of Labor, American Job Center, and that sort of thing. So that's what we have in place right now, and we try our best to connect the individuals to resources out in the community and get them ready.
Yeah, I have a question for you. So as you're transitioning them and getting them ready, are you communicating the landscape of what's happening in the field and what, back to our original question to this group, how are we informing families of what's happening with all the cuts that may be coming up the pike? Like, are you and I don't want to make this a corrections thing, but to the entire group, how are we informing our families of what's coming up the pike? And are we doing that?
Yeah. Are we?
I don't know. I don't know that we are.
Yeah.
I can say I don't think that we are in the way that, because there's so much uncertainty, it's sort of like, what do you tell people?
Right.
So that has, and we were just starting really to look at, for us, looking at, people who are being let go and laid off and things like that, as we're starting to see those numbers tick up in Connecticut. So, but it's a really good point. And I think, Mike, that's something, certainly, for the TANF population and, what kind of messaging we should be using. I mean, for a lot of our customers, and the reentry population is also a prime example. They depend on food stamps and Medicaid and all those things as well. So, and housing.
And all those things like SNAP benefits, and our population isn't able to apply for those things prior to release.
Yeah.
So they have to wait, schedule an appointment when they get out. That's not necessarily helpful.
Yeah, well, and that's a whole policy shift that would be really helpful. So I think, Stefan, in one sec, I think this is a really excellent question of like, we don't know what's coming, so you don't want to over alarm, but you also don't want people to all of a sudden one day have no benefits. So it's attention. Stefan and then Kelly.
My question is for the people that are being released. You guys are doing a lot of great work. Has there been any work around the housing for people that are being released whose families are no longer interacting with them? Because there's a lot of people that get dropped off right downtown Hartford, and they're given the directions to their halfway houses, or they're given directions to the DSS, but they have nowhere to go and they end up being homeless. So has there been more?
Housing is one of our biggest barriers because we don't have housing per se unless they are going to a halfway house or a probation AIC house. What I can say is if they're going to a halfway house, they're not just being dropped off on at one of the counties and given a bus pass. They're directly transported. We encourage our participants to accept that Welcome Center referral because it's a warm handoff and they do have connections to different, not always housing, some of them are, a lot of them are going out homeless. But
Yeah.
we prefer to drop them off at a welcome center, and they have a lot of connections in the community and sometimes can house them.
That's good.
If they have probation to follow, we connect with probation ahead of time and ask them to submit a transitional housing referral. But again, these guys can refuse that. They don't want to follow those rules.
Yeah.
Yeah. You know what I think is important too, Joy? Like, as we're thinking about workforce development, all these training programs that are in the field, and like how do we communicate what's happening?
So the Welcome Center has connections to all of those things and relays all of that information and tries to get them signed up. And that's what happens on a lot of the InReach phone calls too. They give them, hey, we have these programs we can connect you to. Think about that, and when we get out, we can sign you up for these things. But if a guy's going out homeless, they're just trying to get on their feet, and training programs aren't going to help them get an income.
Yeah.
So
Kelly, you have had your hand up. Thank you, Joy. And then let's just hear a little bit of this debate about what to do about informing families. Kelly.
Yeah, thanks, Sarah. And I feel like we could have a whole meeting about the DOC stuff. So I'd be down for that conversation. I have a lot to say on the housing front of that. But to your question, I totally agree with Jill that at this point, like there hasn't been enough clarity around just about anything to have like a tangible thing to say to families across the board. I think where we have like in Greater New Haven, like Mothers and Others for Justice and like certain groups who are already in the advocacy space, bringing it to them has been something that's happened. Where we've really been focusing on is bringing the information to our municipal and state leaders to say, like, here are the numbers, like, here's what's at risk, here's how many people are going to be served, what is the plan. So I just want to share, like, that's really where we've been focusing primarily, but like have also started to pull in the advocacy groups that already are around.
And that makes a lot of sense. I think one of our questions is at some point, parents need to speak up so that those state elected officials feel like they've got somebody underneath them saying what the priority should be. Caroline.
So that's actually what I was going to say. Somehow having sessions where we're mobilizing parents. I know that money's tight, right? So maybe two things. Some sessions online, like the OEC has done with, some of their sessions. We host 2 Gen sessions to inform parents of what's happening. And we as parents host them. Of course, we have to figure out what we're going to say and how we're going to say it. Yeah. But, putting that out to the schools getting ready to close soon. So reaching out to like the Board of Ed and CREC and the private schools or wherever to just say, hey, we're going to have these listening sessions and questions. I don't even know, like answering questions, how much question, what can we answer, but to put this information as we got it out there, just informing parents and saying, this is how you can speak to your representatives and what you can say. That's one. And then the other thing is, I know that we're not necessarily having a 2Gen Parent Academy, but I think this time more than ever is something that we need to have that. And these are the topics that we need to be discussing, having it be an informative session, maybe not the way that we've done it in the past, but just like a group where we're getting together, because meeting face to face has so much more of an impact, and people feel more supported, they feel more connected, and they feel like they have a little bit more sense of safety in this time of uncertainty.
Yeah, so that's a great idea. I see Kelly +1ing you. And I think, let me ask, because we only have 4 minutes, and I'll turn it to Christine in 2 minutes to close us out. I mean, I'm hearing a balance of informing parents, but not jumping ahead when we're not quite sure what's happening. To that point, would it be helpful for this group when something does hit, because it's going to happen in the next 4 weeks max. Should this group come back together, make sure we all have the right facts, and then figure out kind of a plan in kind of relatively short time because when this stuff starts hitting, I know it'll take a while to work through, but to somebody's point, now I'm forgetting who, Kelly, I think, right? We need to let our elected officials know what matters to families. So everybody likes that as a good idea.
It's like
Okay.
a few folks saying yes, that we
Yeah.
should do that.
So because the last question is there a place where organizations are coming together to say we got to be ready for when this happens? And if not, this could be a nice venue for that. Trisha, did you raise your hand? This meeting is being recorded. Yeah.
I guess we have a community partners kind of operation thing going where when the ACF office is closed, whenever there's important communication, a letter will be sent notifying them. So basically, in that way, we have been preparing at least the community partners, obviously without specifics. We can't say, well, maybe this or maybe that. But when something happens, such as the 5 ACF offices closing, kind of letting them know, saying that we don't, have more information right now, but we'll keep you apprised. So I just think it's a good way to communicate with the community partners, like when something happens, something's drafted up and sent to them.
And my thought is that each of us have those networks, right? So that's part of where when something happens, we didn't do anything on the ACF offices. So for folks who don't know, the Administration for Children and Family offices were shut down in New England about a month ago, which
has a real impact. It does.
Sorry?
No, it has an impact, with this.
It absolutely has an impact, right?
Well, so
yeah.
It was actually 5 of the 10 nationally. So it was Boston, it was San Francisco, it was,
no, they consolidated. So New England is now represented in Philadelphia. So and nobody knows, by the way, I understand there's nobody to talk to. You send a general email to like acf@gov.gov, and who knows if you'll get to talk to anybody. It's what I've heard.
Great.
But we need to get off. So Christina, go ahead.
Yeah. I was going to say great conversations, everyone. Thank you so much for being present today. And I think this is the most that I've heard us be engaged as a group. I know we're engaged, but like in terms of chatting more, I think this is very good. And it's got us really thinking about what are our next steps. And so
and I'm hearing, Christina, that we should bring this group back together when there is a major change.
Yes, absolutely. Yep, I did see that in the chat. And I know we lost a few folks already. And so I just want to say thank you so much for today. Thank you for coming today. If you have any questions in the meantime, feel free to shoot myself or Sarah an email. We're happy to respond to that and be very attentive to the needs of our stakeholders here in this group. And so thank you. And I hope that you have a very lovely weekend. Talk soon.
Thank you.
Thank you.
Everybody.
Bye.